This is One-on-One. Stephen Jones is Chief Academic Officer for RWJBarnabas Health. Good to see you, my friend.
Good to be with you again, Steve.
I also should say, full disclosure, we are both Rutgers fans.
Absolutely.
You are hardcore, though. Big Ten, that's the right thing?
Big Ten is a great thing for Rutgers athletics.
And you
New
predict
Jersey.
good things.
I predict very good things. We will grow. Rutgers football, Rutgers women's basketball, Rutgers men's basketball. I'm a total Rutgers athletic geek.
But you're here to talk about healthcare.
I'm here to talk about healthcare at RWJBarnabas Health, our commitment to academic medicine, particularly, Steve.
Yeah, let's talk about that. Is there a physician shortage in the state of New Jersey and in the region? And if not, why do people keep saying that?
Steve, we need more physicians, particularly primary care physicians. New Jersey has great medical schools, and RWJBarnabas Health partners with many great educational institutions, including Rutgers. And medicine in the future will work with teams. Advanced practice providers like nurse practitioners, physician assistants, pharmacists. We need more primary care physicians. We need to train more physicians. And we need to support that team because they will work in a team in the future.
But here's the thing. We've had many offline conversations. I've also done leadership development over at RWJBarnabas Health, particularly with physicians, and talked to them about leadership and communication. And one of the things that struck me is that there's a whole discussion about how we train physicians. Isn't there a whole discussion about the way physicians are trained for the future, and that the healthcare landscape is changing such that physicians need to be trained differently? Or am I making too much of that?
No, absolutely. There are dramatic changes. One, we're not in the bed business any longer.
We're
promoting wellness.
Business? What does that mean?
Steve, I've been a hospital administrator for 40 years. Early in my career, the idea was when people got sick, they went into a bed in a hospital. Today, we're really focused, the medical industry, hospitals, on keeping people well and promoting health. We want people to stay in their homes, stay on their job, stay in their diverse communities that we serve. And we want to support them in that way, not just when they get sick. So it's more outpatient care than inpatient care. It's more preventive medicine than the high tech. We've got it all. We've got the ICUs, and we will continue to grow them. And we have a real big focus on how we keep people well, because that's the goal. That'll reduce the cost of health care.
But Steve, how does that change how you train physicians?
Sure. If you go back, Steve, I'm not a physician, as you know. I'm a hospital administrator. We've trained physicians mainly in acute care hospitals around intensive care beds. We need to do much more in ambulatory medicine, and that is beginning. And both medical schools at Rutgers have ambulatory care facilities, and they work with RWJBarnabas Health in our numerous ambulatory care facilities. There are new methods now, home care, telemedicine that you've talked about on other shows.
Telemedicine means, explain to folks what that means.
Telemedicine means one doesn't always have to go to the city and meet with a physician. Consumers are going to demand in the future sitting on their iPad at the dining room table. Today, we use telemedicine among facilities, from a remote hospital to a larger hospital. But we will be using telemedicine in the living room and the dining room, and talking to families and talking to paramedics that might be there and making diagnosis. Today, it's used very, very effectively in stroke care and in some types of cardiac care.
And it's so interesting from a communications perspective, which I'm in the other part of my life, I do a lot of coaching and training around communication and interpersonal communication. So what I'm fascinated by is the changes that requires in physician communication to be able to communicate technologically in a way that they haven't been trained before.
Right.
That's key.
That is absolutely a key. And newer physicians coming out, they grew up playing Pac-Man or something like that.
How about the vets?
And so...
and then the veteran physicians are more challenging?
Yeah. People say they are. We work with a lot of senior attendings who are very computer savvy and use smartphones and things like that. Years ago, Steve, we didn't know somebody had a heart attack till they got in the emergency room and they put on a 12 lead. Today, we know before they leave their dining room or the bedroom on Sunday morning, because the paramedics have them hooked to the 12 lead telemetry, and we can start IVs right there. The paramedics are talking to physicians in the emergency department, and they're rendering care right in the living room or the dining room where somebody fell, and then going to the hospital.
And that changes
different.
so excuse me for interrupting, Steve, that potentially changes the outcome.
Oh, that improves the outcome dramatically.
Because?
There's literature. Because you start the care fast. You know, time is muscle. Again, I'm not a physician, but time is muscle. And whether it's saving the heart or saving the brain, it's important to do that quickly. And in the new modes of care and in academic medicine, we are teaching people how to do that today. Yeah. And it'll keep more people healthy for the future.
See, before I let you out of here, I'm curious about something. Why do we so often, say in New Jersey in particular, we're taping here in New York City at the Tisch WNET studio, but on the Jersey side so much, why is it that we right now lose so many physicians who are trained in the New Jersey area who wind up going other places, and what are we doing about it?
Steve, we have large training programs in New Jersey. In RWJBarnabas Health, you're familiar with the Academic Medical Center in New Brunswick, Robert Wood Johnson University Hospital, and at the great teaching hospitals, St. Barnabas Medical Center in Newark, Beth, Monmouth Medical Center, Jersey City. We train a very diverse portfolio of students. New Jersey is a large trainer of medical education. Some people go to other locations. It's important to us that we retain these trainees in New Jersey. And we have lots of opportunity. We think the size and scale of RWJBarnabas Health gives us the opportunity to early on encourage physicians to stay in our communities. And we cover a broad swath of New Jersey, about 5 million population, are neighbors of ours. And so we think there's great opportunity to work with young physicians that are finishing their residencies and their fellowships and to get them to stay in New Jersey.
To incent them to stay, Steve?
You incent them? Well, one would offer employment. Remember back in the day, most physicians worked in private practice and did not want to be employed. Today, there's a big change toward employment. So in RWJBarnabas Health, we have those opportunities. We have opportunity to incent them. We have we have every lifestyle in New Jersey, every location, every community type that a young trainee could want to live in and grow a family in and invest in our diverse communities. We think there's great opportunity.
Stephen K. Jones, Chief Academic Officer for RWJBarnabas Health. Good to see you.
Great to be with you, Steve. Thank you.
We're right back right after this.